Hi, my name is Paul Ford and I'd like to welcome you here to Braintree Community Hospital at the heart of Essex. Our aim is to provide the safest, most effective patient-centred services to those that need our care. Building a brand new hospital is quite an accomplishment, and we're really proud that from scratch we now have a fully functioning hospital that is delivering some of the best services that can be attained.
The one thing that struck me above all others here was how promptly I was seen. I'd turn up for my appointment on time and I was always seen on time, and always, in my view, treated very professionally.
I don't think I've ever waited more than about 30 seconds from sitting down here, so you know, it's definitely a huge improvement on normal hospital experience.
First impressions were how efficient it is, how caring and friendly.
I'm Medical Director for Braintree Community Hospital, and my job is to ensure that we deliver high quality care whilst keeping the patient at the heart of everything that we do. So we're a consultant-led service, which means that every patient will see a senior clinician and be treated by a senior clinician when they visit us. So whether you are coming in as an inpatient in one of our community beds, whether you're visiting us as an outpatient, or whether you are coming to our day surgery for an operation, we strive to ensure that you get the best level of treatment in a way that's convenient for you.
So from an endoscopy point of view, we do gastroscopy, which is basically looking into the stomach, and we can offer two methods for that. The traditional way is through the mouth, but we offer a transnasal way of doing it. It's a thinner scope. People don't gag so much when they have the procedure done. It's very quick and patients are in and out quicker. They can eat and drink quicker with that method as well. For endoscopy patients, they have to be seen within 6 weeks of referral. That's quite a tight target, but we do manage to meet it.
We see lots of patients in various clinics, medicine, surgery. We see rheumatology patients, paediatric patients, lots and lots of things. We're a consultant-led service, so our appointments are always with a consultant, so the patients will always be seen by a consultant. They will come in, if it's a patient that needs surgery, on the day of their first outpatient appointment, they can go up to pre-assessment, have a full pre-operative assessment and be given a theatre date on the same day.
I came to see the consultant, went up for a pre-med, all ready to have the operation. And it all just happened, and then they give you a date for your operation.
We operate a one-stop shop, so they can just come straight up here. We sort out all their notes on the premises, get it all sorted. They come straight in here, have their assessment done. They have all their blood pressures checked. If they need ECGs, blood tests, that's heart tests and blood tests. That's all done here at the same time on the same day. All their information leaflets are given to them on the same day. So basically they can go home and they've had everything that they need ready, so they just come back on the day for their surgery.
I think what's very special about Braintree Community Hospital is that care is delivered here in a very timely way. We've already set ourselves a very tough target of 9 weeks from referral to if a patient needs surgery, and in many cases we are achieving that before the 9-week deadline. As well as that, delivering care in a safe and caring environment is very, very important, and results from our patient surveys really do reflect that we're achieving this every day.
In terms of surgery, we offer a day surgery service. So we basically offer procedures across a range of specialties that can be carried out in the course of a day. So generally patients will come in for their procedure in the morning. They'll be assessed by a nurse, they'll go into theatre, have their operation, which may be minor, it may be something a little bit more complex. We'll recover them in the theatre department, they'll go back to the ward, wake up, have a cup of tea, generally get back to normal within the space of about 4 hours. But what I like about the hospital is that it offers everything under one roof. Patients can come here, there's no stress with parking. It's a community hospital and it really does serve the local community.
Well, it's great that it's so close because it means that an appointment is, you know, literally half an hour out of my day, as opposed to it being, let's say, half an hour journey, a waiting time, the appointment, getting back in the car, driving home. So this fits in around my day. I know that I can bring my baby with me and it's literally 20 minutes and we're out. So it's not a huge kind of expedition.
It is wonderful to come to a hospital where I'm not paying through the nose to park my car and having to drive around for 30 minutes.
You can get a car parking space and it's free, that's always nice. Well, I normally come straight through to the therapies reception desk and the lady there, I think her name's Angela, she now knows who I am and she's like, hi, take a seat, so you don't have to give your name or anything, which is really nice. And she'll chat to my little boy as well and make him smile, which he likes. So it's nice to feel that you're recognised, and they must have hundreds of patients in, so it's nice to feel a bit special.
As you can see, there's fantastic equipment, good staff. Clinically, there's a lot of knowledgeable staff, so we can share, bounce ideas around.
So I was impressed by the thoroughness, if you like, of the physiotherapist's diagnosis.
We see a number of different patients. Largely it's musculoskeletal problems, so problems with joints, bones, ligaments, muscles, any type of body issue, musculoskeletal wise, you'll probably end up seeing one of us.
The overriding impression that I was left with was of a very friendly hospital, somewhere that wasn't in any way intimidating. And whilst I wouldn't say I was pleased to be here, I was quite reassured.
Without staff, this hospital would just be an empty shell. They're the part that make it tick and make it very special. I hope that if you are unfortunate enough to have to become a patient, that you find their care, their dedication helps you along the road to recovery. I'm really pleased with the staff we have here. I think they're the best in the world. I hope you also agree.
I got the feel how relaxing it is here. Very relaxing, and from the receptionist, who couldn't have been more helpful, to the nurses, like the staff who were with the consultant. And when my husband and I came here to have something to eat, literally, because I was limping and my husband walks with a stick, they brought all the food over to the table for us.
Somebody would come up every day with a menu and tempt Mother to, what would you like? And I believe that on one occasion they actually made an egg custard for her, because they're tempting her to eat. And in the 2 weeks before she left here, she put on 1 kilo in weight.
And this is actually the first hospital I can say that I've worked in where I actually look forward to having lunch with colleagues. The food here is freshly cooked, it's organic food, it's from the local area, and it's very good quality. The same food that's served to the staff is served to the patients.
Since the hospital's been opened, we've had no MRSA bacteremias, no MRSA infections, and no C. difficile infections. We pride ourselves on cleanliness and hygiene. But of course, that's not just down to our staff, that's also down to you as visitors.
Yeah, the cleanliness is second to none.
The number of people cleaning her ward was almost an unending stream. And she said that the standard to which it was being cleaned was wonderful.
The kindness of the staff is such that one of the gentleman nurses here, even though he was on nights, he made sure that I got the opportunity to shower before we went home.
Braintree Community Hospital prides itself on being a listening organisation, and we really value feedback from both patients and visitors, and we use that to improve our services. So if you have any comments or feedback, then please get in touch.
I've had the pleasure of running many hospitals around the country over many years. However, there isn't a rule book which tells us how to get it right on every occasion. If you have any thoughts or ideas as to how we can improve the services here at Braintree, please let me know. We'd be delighted to hear from you.
They've got something good going here. I only hope local people appreciate it.
It's a very professionally run, clean, friendly hospital.
My mother made a little video, which is on my website, and she said, I would never want to go into a hospital But if I did have to go into hospital again, this is the one I would want to come to. And I firmly and honestly believe that without the wonderful treatment that she received at this hospital, I would not have a mum anymore.
They really are just so friendly here, you know. But it's the help as well. But the consultant has been brilliant, brilliant.
It's a beautiful hospital.